This is Dr. Harika Director, Dr. Harika ENT Care Hospitals, Hyderabad. Today we are going to discuss about the myths and facts of deviated nasal septum. So many people think that deviated nasal septum causes sinusitis, but this is just a myth. Sinusitis is an infection of the sinuses and it is not caused because of the deviated nasal septum. A deviated nasal septum is just the deviation of the nasal septum which is there in the center of the nose. It can aggravate the infection. The deviated nasal septum can definitely aggravate the sinusitis but cannot cause sinusitis. Many people think that deviated nasal septum, when after correction, can recur. So, correction of DNS is called septoplasty. So, after septoplasty, many think that this deviated nasal septum can come back. But this is also a myth. Many a times when we operate in children, less than 18-year-old, only then sometimes it may come back. That too because we are operating in a child who is growing. But if we operate in a person who is above 18-year-old, definitely the bone in the septum will not grow and the deviated nasal septum will not recur. Some may think that surgery of this deviated nasal septum can change the shape of the nose. But it does not. The correction of deviated nasal septum is called septoplasty, but the correction of the external shape of the nose is rhinoplasty. So this is a total different surgery, and the shape of the nose, the external shape of the nose will never change when we do just the correction of the nasal septum. This is a total different anatomy when it comes to the external nose and the septum. So, the correction of the septum will not change the external shape of the nose. Some people think that DNS can cause, deviated nasal septum can cause allergic symptoms, but that is also not true. Allergy is something which is there in the blood. When there is a tendency to have allergy, only then that person will have allergic symptoms. It does not depend on whether they have a DNS or not. But definitely when a person is having allergy as well as deviated nasal septum, they will definitely have aggravated symptoms, because when there is a allergy, the nasal obstruction will increase if they, along with the allergy, if they have deviated nasal septum. But deviated nasal septum itself will not cause any allergic symptoms.